Good morning, student. Today we are going to discuss about determinants of healthcare. So, what are determinants? In other words, we can say we are going to discuss about barriers, hurdles to access health treatment. What kind of hurdles we are facing as the individual is facing to access their health treatment. So determinants mean to say the social, political, environmental that directly influence on your health status. So we have different types of determinants, different types of hurdles. So the first is social factors. Second is policy making is also effect on your health status. Third is your individual behavior. Fourth is biology and genetics. I collect only the 4 or 5 determinants where we can understand how these determinants will directly impact on a health status. How someone is having good health facility, good health treatment, the time they need it, and how the other one having the bad health treatment, the time when they need it in same circumstances. So first we will discuss about the policy making. The first determinant is policy making. So what is policy making? The government make lots of policies for the welfare of the society, for the welfare of their own people. So that policy directly impact on your health status. For example, we all know that the government they increase taxes on tobacco so that their production will be they try to decrease their production. The tobacco nicotine is directly affect on our lungs. Later on we have lots of health issues, those who is having chain smokers. So these are the policy directly impact on the human health. Other that in lots of the countries there are a rule that you can't smoke in a public place, because like I said, with the smoking you will have lungs issues. Later on, with the help of the lungs issues, you got lots of health problems, like asthma is the one health condition. It start those who is a smoker. So we have two type of smokers: chain smoker, active and passive. Active, the one who is smoking directly. Passive, suppose someone is standing beside you and they are inhaling that smoke, become passive smokers. So passive smoker is also comes in the grip of health problems. Later on they will have the same issues, same health issues. So this kind of policy always made by the government for the welfare of the society. This is how the policy making directly impact on your health status. Second, we have the social status or social factor. How social factor influence our health status. In our society we have poor, rich. Someone is poor who is having difficulty to access proper education, who is having difficulty to get proper job, who is having difficulty to get proper money, to earn proper money for their livelihood. So these all things impact on your health status. You can't easily access your health treatment if you are not well settled, if you are not fulfilling your daily needs. This comes in a society. Second, we have lots of discrimination in the society. Discrimination on the basis of your color, discrimination on the basis of your age, of your sex. These things also impact on your health status. Transportation. So whenever we need to access the health, it would be very difficult to get your health treatment on time because of the transportation, because of the lack of transportation. So transportation directly impact on your health status. Public safety is also concerns of your health status. So this all comes in the social factor, which directly affect on your health status. Next we have individual factor. Individual factor, let me think. Yes, individual factor, I will explain with one or two example. We are two friends. The one is a chain drinker, always drink. Another is a normal one. Check their health conditions. The one who is drink a lot, there were lots of health issues as compared to the other. So individual factors. If you quit drinking, you will have your better health life. You will have your healthy lifestyle. You will have your healthy body. So individual factor directly impact on you. We can choose another example, smoking. The one is a chain smoker, he has health issues. The one they are not smoking, they are good as compared to the chain smoker. So individual factor impact on your health status. Now next we have health services. How health services influence, how health services impact on your health status. Due to lack of health services, due to inability of health services, due to lack of health insurance. You know, in most of the developing countries, we have two types of health services: public health service, private health service. In some countries, we have the high level of private health services where the people have to pay for their health services. And suppose if someone doesn't have health insurance and they are living under a poverty line or under poverty, so how they can access the health service immediately? It's very difficult. You need to think a lots of things. You need to arrange money, everything. So because of that things, the delay will happen. Lack of hospitalization will happen. The time you need health services, you won't get. So that's why health services directly impact on your health status. Next we have biology and genetics. How they impact on your health status. Again, another example. We have two people. The one age is 25, the another age is 80. Check the health status. The one who is 25, good health. The one who is 80, there were lots of health issues like less immunity, weakness, lots of pain in joints. All that things are happen. All that things will happen. How come? Because due to when your age is increasing, your immunity will decrease, and because of your immunity is decreasing, you will have lots of health issues. Because you know the immunity is the front warrior. Save yourself from the diseases, from the health issues, from the health problem. So when your immunity is getting down, so the health issue is increasing. So this is the one example how biology and genetic directly impact. Another example. Suppose, you know, I saw lots of things around me. Like suppose if your grandfather have hair loss, your father will have the same issue and you will have the same problem. It's coming from your heredity, coming from your grandfather time. So biology and genetics, it comes in your genes. You will definitely have hair loss in some cases. Not in some, around 60 or 70% cases, you will have the same problem. If suppose someone have the sickle cell anemia, if someone is diabetic, suppose your grandmother is diabetic, that diabetic will come in your father generation, and from your father generation it comes in your generation. Hereditary. So biology and genetics will directly impact on your health status. So that's all, students. This is all about determinants of health. So this is all about today's lecture. next time I will get another topic and we will discuss. Till then, and take care.